So you're a stroke survivor and you've done our video on active sitting. Today we're going to make a transition to active standing. Hi everyone and welcome to Exercise for Health. I'm Richard and today we're going to be doing 10 minutes of exercises in a standing position which will help boost circulation and break up long periods of sitting. So if you're not confident moving in a standing position, then you need to try our active sitting video first by clicking the pop-out banner above my head here, as they will help you move in a seated position. But these movements can be done any time of the day, and also it's quite good if you want to do them every time you get up to go and do something around the house. That might be a good time to put these exercises in. So to start off with, we need to get you from a seated to a standing position. So to do that, I'm going to walk my hips forwards to the front half of the chair. Now it might be that you've got yourself a stick or a frame that you feel that you'd like to use to help you to get to a standing position. So if you've got one of those, then you can use that to get yourself to a standing position. Feet are a shoulder width wide on the floor. And then from there, I can use my hands if I want to here, whatever you feel more comfortable with to get you to a standing position. But I'm going to let my body go forwards, so I'm moving my weight forwards, which is going to start to lift the bottom off the chair. And then at that point, as I feel the weight go through my feet, I'm going to push the feet hard into the floor to lift my bottom up and then drive my hips up and forwards to get myself to a standing position. Make sure you've then got your balance before you make any movement to transition to where you're going to do the standing exercises. So I've got my balance, so now you need to find a surface, something for you to hold on to. Now this could be like a kitchen worktop, it could be the back of a dining chair, it could be a dining room table. In my case, I'm going to go over to one of my units in my living room. So I'm going to make the transition to walk over to here. And then this way then I've got something for me to hold on to while I go through the different exercises today. So this is just there from a safety point of view and balance if you feel that you need it. Again, you might have your own stick or frame that you feel that you'd like to use. That's absolutely fine as well, to keep that close while we're going through these exercises. So the first one we're going to do is we're going to do a shoulder roll. Now we did in the last video that we did, the seated one, we did a shoulder shrug, which was just lifting the shoulders up and back down. For this one, we're actually going to lift the shoulders up and then squeeze the shoulder blades back together and then let them drop back down. So make sure you've got your feet shoulder width wide on the floor. Make sure you've got something for you to hold on to nearby, preferably on your stronger side. If you have got a weaker side of the body from your stroke, this should be on the stronger side of your body. You could also, if you wanted to, turn and face this surface. So I can hold on to it with two hands or one hand if you feel more comfortable doing it that way. I'll show you the exercise from the side as well. So we're going to lift the shoulders up towards your ears, squeeze the shoulder blades back together, and then let the shoulders drop back down. Okay, so that's the exercise. We're going to do 5 of these. So when you're ready, lift the shoulders up, squeeze the shoulder blades back, and then let the shoulders drop back down. Keep breathing with the movement. And if your stroke's affected you on one side, you might find that that side doesn't move quite so much. So really put some focus onto that side. Make sure you're getting some movement in it, but as long as you're not experiencing any pain with the movement, then that's fine. I'm going to do one more, going for 5 on each of the exercises today. Good, okay, so that's the first one done. We're going to go on to the next one now, which is kind of going to simulate an arm movement that you do when you're walking. So for this one, again, I can hold on with one hand and just get this arm moving. If you're confident enough to do it without holding on to anything and get both arms moving, that's fine. And likewise, if your stroke's affected you on one side, so if this side was affected, you might want to then use your stronger hand to support it to get some movement in it. So effectively doing this kind of action, getting some movement around the shoulders to get the arms to swing a little bit. Okay, but if you feel that you need to hold on to one arm to move it forwards and back, that's absolutely fine too. Okay, so I'll let you practice that just for a few seconds. Just as long as you're getting some movement into the shoulder, nice and gently, it shouldn't be too fast. Great, good, okay. Right, so the next one we're going to do is we're going to get some twists going on. So again, if you feel that you need to hold on to your surface, either facing it or to the one side on your stronger side, Then what we're doing this time is we're going to twist the shoulders to turn and face one way, come back through the center, and then twist to turn and face the other way. Again, on this one we'll do 5 on each one, going each way. So nice, slow and steady. Make sure your head follows with you as you turn the body. Make sure you're still stood up tall with the movement. So you can still work on these posture muscles even in this standing position. Good. We'll just do one more on each side. So we're aiming for about 5 on each side. Don't worry if you can't do 5 on each side. And then come back to the centre to finish. Good. Right, we've done 3 now. That means we're halfway through, so we've got another 3 to do. If at any point you're starting to feel tired and you feel that you need to sit down, obviously then we can make the transition to go back to your chair and sit down. But if you're happy to, we're going to carry on and we're just going to do the other 3. I'm going to keep going. So the next one we're going to do is some side bends. Now for this one, because we're going to be moving the body from side to side, it might make it easier for you to take your feet out a little bit wider on the floor. And that will give you a slightly more base of support, so it'll help with your balance a little bit more. But also with this one, again, hold on or make sure you're very close to the surface for you to hold on to. So the movement this time is we're going to move the top half of the body just to lean down one side, like you're taking the hand down the side of the leg, and then come back up to the middle, and then you then go the other way. So we did this in a seated position on the first video, so we're doing it now as in a standing position to make it a little bit more challenging on your balance. And we're just going to do 5 on each side again. And as you move from side to side, you might feel a little bit of a stretch on these muscles around the side of the waist. Good. And make sure you're not doing anything that's going to compromise your balance. So you should be close to your surface for you to hold on to, something sturdy still. And then come back up to the middle and bring the feet back in a little bit. Good. Okay, the next one we're going to do is we're going to do some forward steps. So for this one, we're going to take a step forwards and step back, a little bit like we were going to take our first step to go for a walk. So if you feel with one hand you need something else to hold on to, like a stick or something else to the side of you, that's absolutely fine. But basically the movement from there is I'm going to take a step forwards, put my weight on that front foot a little bit, and then I'm going to move myself back to where I started, and then I do the other foot. Now as you do this movement, I want you to really try and focus on, see if you can get a heel strike with the foot. So as I step forwards, I'm trying to get a heel strike first, rather than the toes tapping on the floor first. So I get that heel strike, then the toes go down, and then I move myself back, toes lift, heels lift back. So heel strike, toes down, put some weight on that front foot, and then toes will lift, heel lifts, back to where I started. So you're just going to alternate between left and right. And back each time. So if you've got an AFO, ankle foot orthosis, or if you've got an FES box, one of the frequency electrical stimulation boxes, then that's fine. Use that if you feel that you need to, because obviously the FES is quite good at lifting the toes up and stimulating the muscles down the front by the front of the shins. And then if you've got the AFO or a splint on your foot to try and pull the toes back anyway, you might find that you can't get much movement around the ankle. But again, it's just stimulating a lot of these muscles in the lower body that you'd use to then start to walk with. Do this on the last side. Good, okay, brilliant. Right, so we've just got one more exercise to do, and that's going to be some heel lifts. Now for this one, it'd probably make more sense to turn around to actually face your surface, your sturdy surface that you can keep both hands on, because this time, with the legs straight, I want you to try and see if you can lift the heels up off the floor. So you're going to go up onto the balls of the feet and then drop back down. Now if you've got a weaker side from your stroke, you might find that naturally you'd probably try and put more weight onto your stronger side as you do this, but I want you to try and make sure that you've got a 50-50 weight distribution between the feet. So don't just work on the dominant side to try and put all your weight on it and then the weaker side doesn't do that much. Try and keep the weight on both feet equally as you're lifting the heels off the floor. So facing your sturdy surface with your hands on it, you're going to lift the heels up. See how high you can get the heels to come up, so you're up on the balls of the feet, and then drop the heels back down again. As you're doing this, try and keep the legs straight at the knee, and you're still trying to maintain a good upright posture as you're doing the movement around that ankle. So again, we'll do 5 on this, so we'll do a couple more. Last one. Brilliant. Okay, I'm going to come back round to turn and face. Okay, so as a little bonus one, if you still feel you've got a little bit of energy left before you go back to a seated position, then I want you to try maybe a little bit of walking, but on the spot. So if you've got your stick or your frame, you can hold on to that, or you can hold on to the surface, but I want you to just see if you can do a little bit of walking on the spot. So not moving anywhere, just getting a little bit of movement in the legs and at least one of the arms. If you feel confident enough, you can do this with both arms on the spot, brilliant. That's absolutely great. But if you feel that you need to hold on to something, please do that. We'll just do that for a few seconds. Fantastic, good. Right, we're going to make our transition now to go back to sit down back into our chair. So I'm going to walk around to the front of the chair. And before we sit down, make sure that you've got your balance, and you should feel for the back of the chair. So you should feel the chair should be touching your calf muscles or towards the back of the knees. So make sure you've got your feet shoulder width wide. Make sure you can feel the chair touching the back of the legs. And then again, if you've got your frame or a stick for you to hold on to, again, use that if you need to. But now we're going to make ourselves sit back down into the chair. Now do this in a controlled manner. I don't want you just to drop straight back into it. So from there, we're going to slowly start to stick the bottom backwards, so we're bending at the hip, body's coming forwards a little bit to compensate. Get a nice controlled movement as you go down, slow and steady, until you're back into a seated position. And then you can relax. Good, well done everybody, fantastic work. Hope you enjoyed that today. I'm going to do one more video for this series, which is going to be a little bit more of a challenge, because it's going to be looking at doing some exercises that you can do around the home. So that will kind of take it on to the next level. But I do hope that you've enjoyed that today, and then I'll see you on the next one. Well done. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel, or click here to watch a recent video. See you soon.